For most people in Africa, getting medical care is a nightmare. It takes hours, even days, to reach a clinic or hospital. So many people must rely on pharmacies, most of them small and family-owned, like the one Kingsley Wills runs in the small Ghanaian town of Tafoakiem.
So you were running out of things?
Running out of things.
For years it was a struggle for him too. Inventory wasn't moving, and when vendors came to collect payment, he had special instructions to staff.
Why they can't tell them I'm not around?
You had to hide from your suppliers.
Your suppliers, because there's no money to pay. It was completely empty.
Then he was alerted to a company called M-Pharma, started by Gregory Roxon, which has an unusual offer to pharmacies. It stocks their shelves and owns the entire inventory.
Think of it as they lease in their shelf spaces to M-Pharma. We make money if you make money. If you don't make money, we don't make money. The software tracks.
33-year-old Roxon returned to his native Ghana 10 years ago and decided to put his education in America and Denmark to use improving healthcare and technology to carefully stock the small drugstores.
So we built a team of data scientists and analysts that could actually take consumption data from these pharmacies in order to be able to do better planning.
M-Pharma now has a network of some 850 affiliated pharmacies in 9 African countries. Its software monitors what's moving or what's needed in any store and can quickly deliver from warehouses like this one in Ghana's capital, Accra. Beyond pharmaceuticals, M-Pharma added services, creating health centers with nurses on staff and doctors on standby. So when Rosemary Hammond came in with a splitting headache one recent morning, Nurse Patience Atia checked her vitals and saw fit to double-check with one of the 30 M-Pharma doctors available online. So far, there's been no added cost for the clinical services, which are covered by revenues from drug sales.
It cost us $350 a month, including the salary we pay to the nurse, the fractional cost of the doctor, because the doctor doesn't have to be physically located at the site.
He says his costs are a fraction of those at the extensive government-built network of community health facilities. These so-called CHIPS compounds, many built with USAID funds, have struggled, barely operational for a lack of resources, staff, and volunteers, says Roxon.
There was no business model that will allow these CHIPS compounds to actually stand on their own. And in an era where government budgets, because of massive debt burdens, are already under pressure, the first things to get cut are social services. And that's what we are seeing.
It's one example critics cite of how the system of U.S. foreign aid favors international aid contractors, mainly U.S.-based private companies, which have scant knowledge of local conditions and little collaboration with local groups.
So much aid has been poured into developing countries like Ghana and most African countries with little to account for. I think if you talk to the average Ghanaian, or I think they do not know that the American people are sending them anything.
Eugene Wodu works for a Ghanaian startup called M-Pedigree, which is tackling another of the continent's major healthcare problems, counterfeit drugs.
Some of the estimates show, some of the UN statistics show, that it is more profitable to counterfeit medicines than it is to sell narcotic drugs. So we are talking about really significant margins here.
It is important to report all side effects.
To combat this, he says, most international donors have paid to set up hotlines Ghanaians can call if they've had adverse reactions to drugs they've purchased. The problem with this approach, Bodu says, few African consumers use mobile apps or call centers, and it's too late. The product is already circulating in the market, much harder and much more expensive to track down.
That's trying to solve a problem in the most inefficient and the most ridiculous of ways.
His company devised a simpler solution, preventing fake drugs from entering the supply chain in the first place. It produces unique one-time use codes slapped on every product when it leaves the factory. A customer scratches off the code at the point of purchase and texts it to a toll-free number. In seconds, manufacturer and production date confirm the product is legit, and the whole transaction leaves a digital footprint.
They know exactly where you are and how to reach you.
Exactly.
Useful in case of a recall due to a manufacturing defect, for example. mPedigree has expanded to 12 African countries. Nigeria, perhaps the worst affected by fake drugs, mandates the system, which is paid for by a small fee imposed on the drug companies.
Nigeria has brought down its counterfeiting problem from somewhere around a staggering 65–67%, depending on the data you're looking at, to last we checked, under 10%. And we think that should be the paradigm.
A paradigm that could scale enormously, he says, if his company had access to some of those international aid dollars. But he and mPharma's Roxen complain they're shut out.
It is pretty hard for a local organization like mPharma to bid and win any USAID project.
Those grant applications are hundreds of pages long, with contracts tens to hundreds of millions of dollars in scope, and local startups aren't staffed to deal with the exhaustive accounting and reporting requirements. That leaves some 90+% of all USAID grants off limits to anyone outside a small circle of contractors, many based in Washington.
The U.S. Congress, the General Accountability Office, the OMB, Inspectors General.
Brian Atwood is a former USAID administrator. He says a lot of people are looking over the agency's shoulder for every cent of the $30+ billion it disperses each year.
And it is taxpayers' money that you're using, so you have to be very careful.
There's this fear of corruption.
Fear of corruption, no question.
He says a chronically understaffed agency is forced to outsource to contractors familiar with the complex process. But mPharma's Roxen sees corruption in the status quo, where large private contractors work mostly within inefficient government systems in countries targeted for help.
To the American taxpayer, you've said, is abetting a lot of corruption.
Exactly. You have people that move from USAID with the inside knowledge to join these big development contractors with the inside knowledge on how you win these bids.
USAID Administrator Samantha Power declined our invitation to appear in this report. In 2021, when she took office, she pledged to increase the number of dollars that would go to locally led efforts to 25% by 2025 and 50% by 2030. Nearly 4 years on, that percentage has barely reached double digits. The agency has moved to simplify the application process and build capacity in local groups so they can apply for its grants. And that has so far made discernible progress in Central America, says Atwood.
Something like 1,800 direct assistance grants have been offered to local organizations. And as a direct consequence of that investment, the migration coming from those countries has gone down considerably. That investment has really paid off.
Whether such initiatives continue in the new Trump administration is unknown at this point, but significantly, Atwood says, the effort in Central America had the support of Senator Marco Rubio, nominated to be the next Secretary of State. For the PBS NewsHour, I'm Fred DeSam Lazaro in Washington.